Then you can have to go this way without, huh? Right. Yeah. So he's a 38-year-old man who came to us earlier, and he's had this, which you saw in the video right now, I guess, that he's got paralyzed both lower limbs. Isn't it, Parimala? You showed that. It's almost like a frog-like state, and he probably had a poliomyelitis when he was 6 years of age, and that is the time he had, according to them, one leg was paralyzed, other was not. But very recently, I think 10-15 years back, both his legs became paralyzed and he was paraplegic. Although he was doing his work, he was able to walk with a stick. One leg was fine, he was able to walk with a stick. Now, 7 months earlier, he went to the doctor for what? Shortness of breath. Then he was told to have high creatinine and hypertension. So from then his hypertension, high creatinine saga continued. So we are thinking he has got a renal failure due to some reason we do not know, and from there he developed hypertension. And now you look at the changes in the heart. So this is a classic of hypertensive heart disease, concentric LVH. This is very, very prominent. And he came to us with hypertensive LVF. His BP was 240 by 140, and we could manage to bring down the BP and fix his LVF. But in the meantime, his brain damage has occurred. So right now he is in a locked-in state. His eyes are open, but nothing else is moving. With deep painful stimuli also, a little bit of flicker of movement is there, but nothing else is moving. So as you can see here, the LV is not also contracting well. So the ejection fraction seems to be reduced. Yeah, it's 30 to 40%. So he's got a reduced ejection fraction, systolic heart failure, along with, of course, the the substrate for heart failure, which is the LVH. So we'll quickly just look at the other areas, short axis, and then we look at the aorta. You can see the 3 valve cusps here. You can see the left coronary artery here. See the right coronary artery there. These are the ribs shadows which are coming, which are blocking the pulmonary artery from view. Okay, because that's where this is where you had the pulmonary artery. So we are not to see that because of these rib shadows. Okay, because somehow his ribs are like that. Okay, now I go to the fourth chamber view. Here it is. Here. Here's the 4-chamber view. LA, LV again very, very bad, and posterior effusion is there, mild pericardial effusion because of the heart failure. No, these are not seen actually. This is a blank area. Yeah, and this is the dorsal aorta. This is the mild pericardial effusion, and the posterior wall, and nowhere else. Okay, left atrium, right ventricle. So that's it. You can see the tricuspid jet if you want. Pulmonary artery pressures, yeah, tricuspid regeneration, you can see a little bit here, not well visible. We can of course go into the calculation, but it's not really needed. As we know that he will be definitely having good amount of pulmonary arterial hypertension because of this heart failure. But of course he's come out of the crisis, the pulmonary edema crisis. Okay, that's it.